Good afternoon, everyone. I'm Sarah Rosen-Wartell. I have the great honor of being the president of the Urban Institute. And before I jump in, I'm going to just start us off with a few notes of housekeeping. We are recording this event, and both the recording and relevant links will be posted online afterwards at the Urban Institute website. For accessibility, we've provided ASL interpretation and CART captioning. You can adjust your caption settings in the toolbar at the bottom of your screen. All of the participants are muted, but you can type your questions into the Q&A box at any time. We'll do what we can to get through those. And we'll be sharing a link to a post-event survey, and we ask that you share your feedback with us. It's really helpful for us and the panelists to hear what you're thinking about, and it'll shape our work in the future. And if you'd like to join the conversation on X, use the hashtag #LiveAtUrban so you can find the others who are also joining the conversation. So with all that behind us, I just want to first say a thank you to our friends at AARP for supporting this event, and Joel Leskovitz, who's Senior Director, Social Security and Savings of the AARP Policy Institute, who will join us to moderate the panel discussion that comes after the conversation that I'll have in just a moment with the commissioner. The Social Security Administration, which serves more than 7 million beneficiaries, 70 million beneficiaries, and delivers vital services to Americans every year, is experiencing a customer service crisis. Declines in SSA's inflation-adjusted budget, combined with complex administrative burdens and outdated IT systems, have led to long wait times for basic services and especially large backlogs of disability insurance claims. Now, these processing challenges have real consequences for people's lives, economic and health hardships, including even bankruptcies, evictions, foreclosures, and greater health risks from delayed access to health insurance and a stable income. Long wait times have been shown to reduce new applications too, making the program less available and accessible to those who need it. Urban Institute researchers Chantel Boyens and Jack Smulligan have analyzed the factors that have contributed to the current crisis and developed a set of recommendations for addressing the current backlog, as well as ways to prevent them in the future, recommendations that will require Congress to act. Their research comes at a time when Congress is actively debating agency funding levels, which can make a huge difference to hundreds of thousands of people with disabilities being granted access to the basic income support and healthcare next year. So to start this conversation off, I'm really pleased that we're going to have a conversation with Martin O'Malley, the Commissioner of the Social Security Administration. Well known to many across the country, and especially in the state of Maryland, as first Mr. Mayor and then governor for his leadership of the city of Baltimore and the state. But today he's here as the 17th commissioner of SSA, responsible for taking on this critical challenge. Welcome, Commissioner. It's great to have you with us.
Thank you. Awesome to be with you. And I'll join you in also thanking AARP and Jack Smulligan and all those that were a part of this really insightful report. And let's hope Congress acts on it. So shall I share a little bit, Sarah, just kind of like a 30,000 foot view, and then we'll just have a conversation?
That would be great. Why don't you get us started there?
Sure. When President Biden asked me to come to Social Security, it was not because, everything was going great. It was because we had been pushed into a customer service crisis by what was effectively 10 years of staffing reductions imposed by Congress. I don't believe anybody in Congress intended to do this to the agency necessarily, but the result was that we found ourselves trying to serve more customers every single day than we ever had, record high every day, with staffing that had been reduced to a 50-year low. And the three big, glaring problems that affected a lot of Americans day in and day out was, you mentioned it, that deadly backlog in initial disability decisions. We now estimate that more Americans die waiting in line than ever before for a disability determination. And the second big challenge was the hour-long waits when people called our 1-800 number for benefits they had already earned. And then the third one was the injustice we were doing to far too many Americans when through no mistake of their own, we overpaid them and then would intercept 100% of their check until we were repaid. The underlying context of all of those problems was the reduction in staffing. It's because we are such a staff intensive agency. It's almost like a school system, with more and more students, but fewer and fewer teachers. It means that teacher is going to have larger and larger class sizes and take longer and longer to get to kids that are in trouble. A similar dynamic happened here. However, the senior executive service has really responded to this moment and to this challenge. We are now being open, honest, transparent about our challenges. If you checked out our website, Social Security's website, and go on the icon that says Security Stat, you can see 7-year productivity trends. You can see real-time service delivery up until the latest month on our main lines of service. A couple highlights. We've been able to reduce that speed to answer or wait time on the 1-800 number from 42 and a half minutes last November. And now on a rolling 30-day average, we've gotten that down to 11.3 minutes. We have gone 18 weeks in a row for the first time in a long time of closing more disability cases on the back end than we open and have filed on the front end. And we also eliminated that practice of intercepting 100% of a beneficiary's check when we make an overpayment. So those are a few of the highlights. We can get into it and unpack any of it that you like, but I've been very proud of the way that the agency has responded. We had, last year, Sarah, we had the biggest increase, year-over-year increase in our federal employee viewpoint survey participation rates, employee engagement up, leader lead is up. And all of this is because of the heart and the passion and the commitment that the people who haven't quit yet have for this important mission of serving other Americans. So why don't I pause there and we'll just talk a little
Yeah,
about.
well, I'd love to get you to start to talk about, first of all, it's wonderful to see the sort of focus on execution that you've brought to your other public sector roles here. And in many ways, that's a perfect challenge. It meets perfectly the challenges that the agency faces. But one of the aspects of those challenges is that you serve the most vulnerable populations. You are serving older Americans, Americans with disabilities, people with low income. And so the solution of many other kinds of services to go online and get the app and do all of those things are not as easily applied, and you are resource constrained. So talk a little bit about how you think about meeting the needs of the population that SSA serves.
Yeah, sure. The people like Carolyn Colvin, who was our acting commissioner here, and she's now come back. Her office is right next to mine as commissioner emerita. She laid out a vision many years ago for where Social Security needs to go, with more and more people wanting to do their business online. But as you point out, some people can't do that. Some people, like my 93-year-old father-in-law, say to me, "Mart, when I call an 800 number, I just want to talk to a person." And I was in a field office in Johnstown and talking to a woman there who's on SSI. And I said, "How many times do you come into this field office?" She said, "I come every week to drop off my pay stubs to prove that I'm not earning too much." It's that SSI program is a extremely complex program. And as you pointed out, is also a program for the poorest of the poor. So our approach is, the vision and the future architecture that we're moving to is that if you want to get your business done online, we have good ways for you to do that. If you want to come into a field office, our hope is that you can do so without having to come in 3 different times and wait in line for an hour and a half. So our vision also on SSI is to move so much of the constant reporting to these little devices that most of us have, which are phones, so that we can do a kind of have a digital approach to what is now a huge administrative overhead for us, and a lot of work that we unnecessarily heap on poor people to take, you know, two buses in to report their earnings. So so that's our website has actually been one of the great success stories here, even in the declining staffing. Sometimes people, members of Congress will say, "Well, why don't you just make up for the lack of staffing and IT budget?" Well, we could. In fact, the only thing that's been keeping our nose above the water is some enhancements in IT and automation, and the website has been one of those things. The numbers of people that now have a MySSA account, the number of people that actually apply for benefits online, that has been consistently growing. And we want to make those options more widely available and have other things that people can do online. We're not there. We don't have all of the service lines online yet, but we strive to get there.
So let me ask you about two aspects of the challenges here. The first is the resources, and then the second is even the design of the program that Jack and Chantel talked about in their report. Um, uh, their report estimates that to deal with the disability claims backlog, you would require an increase of about 1.3 billion, which seems like a large number until you start to think about the scale of the resources that flows through the Social Security program, and an additional infusion of 1.8 over the next 3 years for disability determinations, along with sustaining the base. If past is prologue, you may not get all the way there in this current budget environment. How will you handle that, and what can you do what will you be able to do if you get these resources, and if you aren't able to get these resources, what does that mean for your ability to serve 70 million Americans?
Yeah, let me try to answer it this way. You know, you kind of alluded to the fact that when you deal in numbers with an agency that's as large as this. Uh, Here's another way that I have found useful to communicate with members of Congress about our overhead budget, our administrative budget, our customer service and IT budget, if you will. We spend about 1.2% of, on overhead. That is to say, if you look at our ratio of overhead to the benefits that we pay those benefits with about 1.2% when we did it well. That 1.2% has been reduced to less than 1%, primarily by Congress. Every year, the president puts in a higher amount, and Congress cuts it. So far in the last 4 years, Congress has undercut the president's proposal by about $3 billion. So our annual budget is about 14.5 billion. That's what that less than 1% is right now. So it is not, while any number that ends with a billion sounds like a large number, and it is, but what the additional 1.3 billion would do for us is, first of all, it would allow us to meet our fixed costs. Our fixed costs go up by 600 million, which is why level funding is not really level staffing. When they do level funding and your fixed costs go up by 600 million, the way this agency is forced to make that up is by letting attrition do its thing and reduce us to even lower levels of staff. So how do we make progress on these things even in the absence of staffing? That's the open question. I'm looking at a map of the United States right now. My eye focuses on Ohio. We lost a field office in Cleveland without warning. It just imploded. Attrition doesn't care. And sometimes if 5 people all decide to leave in the same week, you don't have enough staff to keep that office open. Having said that, some other successes that we're seeing is in, with the 1-800 number, we're actually able to move to a more modern platform. It saved us money, and it gives us much better shot at doing the sort of customer relations management and chat bots on the front end and better services for our people. So how much longer this agency can continue to run up that downward moving escalator is an open question. Uh, uh, we're at a 50-year low now. I do think, though, I'm starting to see signs that Congress is waking up. Many years ago, and I guess you'll get into this in the report, an OMB director decided to say that our overhead was discretionary spending rather than mandatory spending. And ever since, we've been lumped into an appropriations committee umbrella that they call on Capitol Hill Labor H. We don't even warrant an initial in the term Labor H. And it's because it's more popular for Congress people at home to be able to say, I voted for increased cancer fund cures, or I voted for increased child care credits. And as a result, our budget gets short shrift. It's that because we are so large, we actually give Congress flexibility to move, in essence, authority to other agencies. But how we do, but right now what we're doing is a lot of using the data that we've long collected to create effective tactics and strategies, and to deploy wherever we can automation aids that help us to do our work. I'll give you one of them. In the disability determination, shortly before COVID hit, we created a tool called Imagine. Imagine takes 1,000 pages of medical records, and the machine is able to tell the examiner there's a medical listing described in these records on these 23 pages that you need to pay particular attention to. Now, we are required by statute to pay attention to every single page, but the machine can help us focus our attention on those pages that matter most. And increasingly, as we move to structured health IT, that will also help us to reduce the time. Uh, uh, a lot of the time that we spend on disability processing could be aided by better IT systems and better automation, and perhaps the use of tools out there that we don't yet have but are being developed. As technology always improves, we waste so much time, Sarah, just waiting around for documents in order to fully develop a claim, in order to make a decision. And this Imagine tool has been helping us speed up that time, look at the cases that are in staged pending, cases that haven't even been assigned. But if they're developed enough, that Imagine tool will be able to tell the examiner, Martin O'Malley's case looks to be 75% a likely allowable. You might want to pluck that from the queue right away because he appears to be a person who is in need and meets the requirements of the statute. So look, in each one of these processes, there's 100 different things we can stand to do better, and that's what we
So
ask ourselves every 2 weeks in order to provide better customer service.
So you mentioned technology and its potential in the future, and we've also obviously talked about the nature of this population. As you start to turn to technology tools, so I'm going to ask you a two-part question. The first is, how do you make sure that we are protecting against either the disadvantage that some populations face because of the digital divide, you briefly mentioned that, or how do you make sure we're protecting against perhaps bias that may be built into some of these technology tools that are built on large, reading large swaths of information? And then the second thing I wanted to ask you to get at before we lose our time is to talk a little bit about how these customer service challenges relate to the huge issue that Social Security faces, which is Americans' trust that it will continue to be there for them in decades and decades ahead, when they hear so many think tank denizens and others spending their time talking about when the insolvency date will come. Whoops, I think I just lost the commissioner.
Hold on.
There you
I'm
are. Yay. Okay. So two
uh,
questions, trust
got
and
it.
advantages of technology, but also their potential downsides.
Yeah, this organization for a long time has collected a lot of data on everything that we do. Like everything, every dollar I ever earned from my first job, I ever had a W-2 and everybody else. So we actually do, we don't have a lot of money right now to spare, but man, do we have a lot of data. And we have people here who have been required for decades and decades to evaluate, to audit, to random sample for accuracy, uh, awards determinations, amounts, and all of those sorts of things. When it comes to AI, it's and guarding against possible biases that are built into algorithms or built into the machine learning or what have you. It's 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 a it's kind of ironic that AI is going to cause us to think a lot more.
Look, good thing we're still in
It's going
business.
to cause us to think a lot. Yeah, it's going to cause us to think a lot more and to protect against those unintended consequences, unintended biases. And you do that by constantly auditing and examining, doing the random samples, and making sure that whatever tool you're using does not have a disparate effect or is using. We ran into this in state government. We had to make sure that we don't use location or zip codes as a proxy for race or other things of that nature. So it requires some trained people and skilled people. We have a hard time keeping people, hard time hiring people, but we have to have them in order to enable that sort of ongoing analysis, which we need to just think of as hygiene when it comes to using AI tools. Let me talk about the trust thing, though. Trust is as essential to the life of the democracy as oxygen is to life on our planet. And right now, every democracy the world over is dealing with a diminution, disintegration of trust in public institutions, trust in our leaders, trust in one another. Uh, and without trust, you can't really, you no longer have much of a country. So I see this customer service challenge and the longer term, restoration of long term fiscal health of the age of Social Security as being part and parcel of the same journey that we're on here. Um, the more we can restore trust in customer service delivery, that if you call, we'll answer the phone, that if you file a claim, you'll get a ruling before you die. The more we can restore basic trust in the operations and the customer service, the responsiveness, and yes, the humanity and the compassion of the service we offer, the more oxygen there's going to be for that larger challenge of restoring the 75-year fiscal health of the program. Now, it must be said that contrary to everything in the newspaper and that Social Security is not going bankrupt. Social Security cannot go bankrupt because Social Security is a pay-as-you-go system. Having said that, we did the last time Congress looked at Social Security and created that 75 view into the future. They built up a large surplus reserve. And it's the depletion of that surplus reserve that allows people to say, oh, it's going insolvent in 2035. Well, as a whole, it isn't going insolvent, but if that surplus reserve is depleted before us baby boomers pass on to our eternal reward, then yes, we're all going to see a reduction of 17% in our benefits, which we can't allow to happen as a people, as a republic, because for the 50% of seniors who live almost entirely on Social Security, that 17% reduction can be catastrophic. Uh, so the solutions that have been put forward in Congress by others are actually pretty straightforward, and they're very much directly tied to the reason why that surplus is being depleted sooner rather than later in the first place. And those solutions that have been offered in Congress is to require wealthier Americans to start paying into Social Security again. Uh, the reason why their forecast uh, of that surplus reserve lasting through the baby boomer bulge turned out to be a bit off, have been advanced by 20 years, is because income inequality, changes to the tax code, drove more earned income out of the bracket that Social Security applied to. And so it has less money. This is a totally solvable problem. As the customer service challenge is solvable, so too is this 2035 cliff a solvable problem. It's just a matter of math. And it's not most Americans, in a time of great political polarization, it heartens me as one American, the one who's running Social Security, that 80% of people, regardless of party, believe that we should extend Social Security's strength, indeed expand its benefits into the far future by asking wealthier people to pay into it again. So this is a solvable problem. And as we restore trust in customer service, I believe that there's the will in Congress to address this solvable problem of Social Security's long-term fiscal health.
Well, if we're going to find solutions, I feel better knowing, Commissioner, that you are working on it. I noted your confirmation hearing at a time of great polarization. There was a pretty strong consensus of the challenges that you would be facing, but also I heard a surprising amount of support for you to be able to tackle them. And so it was great to hear you today. Thank you for taking time to be with us. Thank you for your work on serving 70 million Americans. And I hope that the conversations ahead for you on Capitol Hill are successful in meeting some of the recommendations that come from this and other work. Thank you,
Hey,
sir.
thank you, Sarah. Pleasure to be with you. Thank you again. Bye-bye.
And with that, I'm going to turn it over to Joel Iskvitz, who I think is back from a fire drill. Thank you, Joel, for making it back. Oh, it looks like he's in the lobby, but he is online. Yay. Thank you for doing that from AARP. And I will let him introduce the rest of the panel and just say thank you to all of you for joining us.
Thanks, Sarah. And hopefully my tech is all working. We did just have a fire drill, so I'm just outside of our building. And thanks for the conversation. I hope that I'm not going to be too redundant. I did not, of course, racing down the stairs, get to hear everything. But I, of course, have heard the commissioner speak about this problem and his tireless work on this issue. You can see the energy that he puts into resolving some of these challenges. And once again, thank you to Urban for hosting. I know it's a very busy month for you, and so pulling this event together, much appreciated. Just as a note, we'll be taking questions from the chat, so feel free to submit as this conversation unfolds. My name is Joel Iskvitz. I am the Senior Director of Social Security and Savings at the AARP Public Policy Institute. Prior to that, I served as Deputy Staff Director and Chief Counsel for the Senate Aging Committee. It's been about 8 budget cycles since I was last on the Hill, and I'm sad to report that this funding conversation has not changed much in the interim. What has changed is a growing backlog exacerbated by COVID closures and a lack of staff and resources to catch up. Before I introduce our panelists, I do just want to underscore, and I'm not sure if it was mentioned earlier, but SSA funding is different than most federal agencies. So in this case, SSA is not asking for money that could go to some other worthy federal program. Rather, they're asking for access to money from the Social Security trust funds. The majority of SSA's administrative expenses are paid that way, but it still requires annual approval through the appropriations process in order to access the money. So at this point, I'd like to bring in 2 experts who wrote a report AARP commissioned to do a deeper dive into the funding challenges and the potential solutions. There you see them on the screen, Jack Smolligan and Chantel Boyens. They're both at Urban Institute, although in a prior life they served at the Office of Management and Budget, and they both focused on SSA among other agencies there, but they have a real understanding of all the under the hood issues facing the agencies. Jack is the Senior Policy Fellow at the Income and Benefits Policy Center at Urban. Chantel is a Principal Policy Associate in the same office and is currently doing a part-time detail at SSA. Let the record reflect, today she is speaking as an Urban researcher, not on behalf of SSA. Chantel, let's start with you. Your paper detailed the drivers of the current challenges facing SSA and the size of the issue. We heard the Commissioner and Sarah discuss the role of funding, staffing, and technology. Can you talk about the extent of the problem today?
Yes, thanks, Joel, and thanks for kicking us off and letting me dive sort of right into these issues. We were set up well by the Commissioner and by Sarah's discussion, so that was great. Jack and I, when we undertook this research project, we wanted to do a deep dive into understanding exactly how we got to where we are today with SSA's, current backlog and customer service challenges. And so when we went back and looked at the data, what we found is that since 2017, the number of people waiting for an initial disability decision more than doubled, from 523,000 people to 1,178,000 people waiting as of the end of September of this year. In addition, the amount of time that an individual must wait for a decision on their initial disability claim also doubled from about 110 days, that's over 3.5 months, in 2017 to 218 days, that's over 7 months in fiscal year 2023. And that doesn't include additional delays that happen when an individual needs to appeal the decision and go through further stages of review. And at the same time, people trying to, contact Social Security for any range of issues, needs to call the agency on the 800 number or come into a field office. We're facing higher wait times. So for calls to SSA's 800 number, the wait time nearly tripled from 13 minutes in 2017 to 36 minutes in 2023. And, I'm giving you a snapshot of the data up until just recently, but the reality is also that, given where funding is currently, these numbers are already, are not looking good for the future, and the actuaries are projecting increases in the number of claims coming in as well.
So yeah, those numbers are not trending in the right direction, certainly. You mentioned before about looking into the factors. So what factors have contributed to the crisis state that we're in today?
So the situation confronting SSA and the people who are applying for disability and retirement benefits, or again, just trying to conduct routine business on the phone or in person at an SSA office, is really needs to be understood by looking kind of at 3 key things. So the first 2 are the funding, what's happened with SSA's funding over time, and then kind of ongoing impacts from COVID-related disruptions to SSA's operations. Both of those have led to staff losses and really high turnover that have reduced productivity. The third thing is a change in the mix and the number of new claims that are coming into SSA, its main workloads. So first of all, since 2018, SSA has received nominal increases in their budget from year to year. But in reality, when you look at the numbers and adjust for inflation, SSA's budget fell in real terms by 9.2% since 2018. So this might make people wonder, well, why didn't we see a backlog or customer service crisis emerge sooner? And the answer is that, while we all know retirement claims have been increasing, the number of new disability claims has been falling. So since 2011, the number of new disability claims fell by 52% as of 2023. And why is this important? Disability claims are far more detailed. The process for making a decision is more complex than a retirement or survivor's claim. It's often more lengthy. It involves more steps, stages of review. As a result, making disability determinations for disability insurance and SSI benefits takes up over half of SSA's administrative budget. Even though retirement benefits are by far the majority of Social Security spending. So because disability claims, new claims, have decreased so much since 2011, the agency has been able to keep backlogs and wait times manageable despite low funding, despite those cuts in real terms that I just described. And that's by redirecting funding, right? That would have gone to disability claims, into retirement and other workloads as things changed. Unfortunately, that approach to funding SSA doesn't work anymore. You know, we had COVID hit, there were field office closures, low funding meant losses in staff, and that led to turnover, which reduces productivity. On top of that, disability claims, that downward trend has bottomed out. And they've stopped, the number of new applications isn't declining anymore, it's actually increasing slightly. So even though there's been this shrinkage, you know, the funding path and where we're at with claims means that SSA can no longer get by with really modest nominal increases in the budget in the near term. And not without sort of the very real impacts that we're seeing now with, you know, with erosion in customer service, higher wait times, and, you know, over 1 million people waiting in the disability backlog for a determination. And, you know, this is also with real impacts to the individuals who are waiting to apply for those benefits.
Yeah, and we will certainly get to those impacts shortly. But I do want to just drill down a bit on, you know, we mentioned earlier the appropriations process being unique for SSA. So could you share a bit more detail there, and how much money SSA would need access to begin chipping away at these backlogs?
Yeah, so, you know, in our paper, we looked at the fact that SSA's budget is a bit unusual in that, you know, Social Security benefits are fully funded up front. They're already provided. You know, Congress doesn't need to act to, you know, for an individual to receive benefits that they've applied for. And funding for SSA's operations comes from that same source of funding, except the appropriators have to act every year to decide how much of that funding is provided to the agency for its administrative expenses, for operations, for staff, for IT, all of that. And when those annual appropriations aren't sufficient to meet the volume of work, SSA has to make difficult decisions about what to do. And because disability claims are more difficult and lengthy and expensive to determine, low funding for SSA translates directly into an increase in the disability backlog and the increases in wait times that I described before. And, you know, in the past, the disparate harm to people with disabilities from low funding for SSA has been somewhat minimized, because for some people who receive disability insurance, they get retroactive benefits. And those benefits, you know, can help them recoup some of the costs that they incurred while they were waiting, but they do not fully sort of cover all of the impacts that can happen to folks who get stuck in the backlog, especially for a very long time. And some of the harms that are caused can't really be reversed. This includes evictions, bankruptcies, forced sales of a home, you know, costs from deteriorating health, and loss of employability. And so this can undermine the program itself, because high wait times actually deter people from even applying for benefits that they are in fact eligible for. And that decreases access to these programs that people have contributed towards. And, you know, a really important point here, the kicker, is that delaying disability claims in 1 year because funding was too low for the operations budget in 1 year just means that the agency has to do the work next year, and that it will cost more, because now the claims that need to be reviewed are older. Medical evidence goes out of date. New steps have to be taken. So underfunding SSA in 1 year really doesn't save the government money. It just makes it less efficient. And so when we looked at this at the time that we were reviewing SSA's budget and trends and projections, we estimated that about, you know, an additional 3.1 billion would be needed to fully, you know, to address the backlog and kind of just prevent it from growing over a multi-year period, but it would still leave over 1 million people waiting for an initial decision.
Yeah, this is certainly not a quick fix or a cheap fix. And Jack, let me bring you in. You've been patiently waiting. You worked at OMB for 27 years, so you've had a firsthand view of the funding process over time. Why is the appropriations process not working for SSA? And can you walk us through some of the steps and what is going on currently with the funding?
Yes, and yeah, thank you. And let me just sort of set a little bit of context. Is right now Congress enacted a continuing resolution. It's what's known as the CR until December 20. Now, under the CR, SSA has to operate at the prior year's funding levels, and we don't really know when or how the current funding impasse will be resolved. So we want to sort of look at both that kind of near-term funding need, but also what SSA's need is over a multi-year period. We do know that the discretionary funding limits are very tight, and that they have been regardless of the party in power in the White House or in Congress. And as the commissioner noted when he was talking with Sarah, the appropriations subcommittee responsible for SSA is also responsible for the National Institutes of Health, for childcare, for Head Start, for LIHEAP, and funding for more SSA staff to adjudicate disability claims. While it's vital, it's still a hard sell in that kind of context. So we're really looking at two different types of funding needs. First, funds are needed so that SSA can keep up with the pace of new claims. As Chantal described, that's really a big driver of costs. And that way we can stabilize the backlogs. You can think of it basically that for each 1,000 new claims, it costs SSA more than $3 million to process those claims through the multiple stages of review. But equally important, SSA needs a temporary infusion of funds over a set of years to work down the over 1 million backlog of claims so that we don't have to kind of accept that as a new normal when in the past we have operated with substantially lower cases in the pipeline. And that's a bit of the context, but I can elaborate on some options as well. So,
Great. Yeah, I mean, you mentioned discretionary caps. I guess could you quickly just walk us through what that means and how those impact the agency?
Yeah. So I mean, I think the way to think about it is that the appropriators are dealing with an annual process that's always under a lot of pressure to manage just kind of normal increases in costs. And that kind of process has a very hard time dealing with the need for kind of multiple billions of dollars for something like what we're describing has built up with SSA over so many years of underfunding. And so it's a process that can't easily manage that. And so what Congress has developed is a variety of special mechanisms, and each one has a certain utility given the political and procedural constraints that the policy leaders are experiencing. But the important thing, sort of the key point with this, is that these special mechanisms are part of the well-established process, and what's needed is the political will, and especially the bipartisan political will, to use the mechanisms. And so the first one to kind of illustrate is a one-time multi-year mandatory appropriation of funds. And looking ahead to next year, regardless of which party is in power, Congress has some major issues to address. There's expiring tax cuts, and there's expiring Affordable Care Act premium supports, and all of those things are multiple hundreds of billions of dollar issues. And in that context, an appropriation of $5 to $10 billion for SSA and a one-time multi-year mandatory appropriation of funds would not be large. Alternatively, Congress could declare the situation at SSA an emergency and provide a discretionary appropriation outside of the spending limits. And Congress has shown an ability to act with these mechanisms when they've recognized that a situation is unacceptable. And you think about the longstanding underfunding of tax enforcement that led to a large appropriation for IRS, shortfalls in funding for veterans health that led to increased funding for VA through special mechanisms. Underfunding of wildlife prevention work also led to creative mechanisms. And some of these mechanisms are available to SSA as well. The thing to keep in mind is that a one-time multi-year appropriation risks the backlogs returning when the funding is gone. And that leads to other potential conceptual changes in how SSA is funded.
Yeah, I mean, this is a challenge, not just on the federal level, of course. I mean, I think one of the additional challenges here is that the idea that we have state employees administering benefit programs. And I noticed a question that came in before the panel noting long lines in Georgia, even for dire need cases. So can you explain both why SSA is unique in terms of that mix of state and federal employees and approaches that could help with that dynamic?
Yeah. So most federal benefit programs that are administered at the state level, things like SNAP, like Medicaid, TANF, they receive mandatory funding from Congress, and it's mandatory funding for those state administrative expenses. It's usually matching state spending. So SSA is unusual in having a mix of both federal and state employees, with the cost of the state employees fully funded by federal discretionary appropriations. So one option would be to kind of conform SSA's practices more closely to SNAP, Medicaid, and TANF. And to do that, Congress would need to act and to move state disability determination service costs so they're fully funded by a mandatory appropriation and removed from the discretionary caps. And under this option, SSA would still have special funding needs for backlogs at the federal level, but it would be removing a major cost pressure in a major area of backlogs today. And at the same time, SSA needs to work with the state disability determination service leadership to stabilize turnover. We know backlogs vary widely across states, as does compensation of staff, and that all requires a careful review.
Yeah. Well, thank you, Jack and Chantel. I'm going to ask you to stay on the panel, but I want to bring in and fill out the rest of our panel with Rebecca and Tracy. Rebecca Vallis is the newly installed CEO of the National Academy of Social Insurance, but she's been in the trenches on these issues since serving as a legal aid attorney in Philadelphia more than a decade ago. Tracy Groninger has also spent her career focused on protecting low-income and disabled Americans. She is the Managing Director of Economic Security and Housing at Justice and Aging and also serves on the board of the Academy. Both Tracy and Rebecca are fierce advocates, and their perspective here will help us show the human toll behind all these numbers. Of course, I'm going to share a couple more numbers and confuse everyone with math. But what we've been hearing a lot, or I've been reading a lot about peak 65. Average 11,000 Americans reach that age daily. We're in the midst of a 4-year window where more than 4 million Americans a year will hit this milestone. As we all hopefully know, 65 has not been the Social Security full retirement age for quite some time. But 65 is a special number in that low-income Americans who are not disabled can apply for SSI at that age. And of course, anyone of any income can file for disability insurance all the way up to their full retirement age, which is moving up to 67. So the basic idea here is that there's a whole lot of people interfacing with SSA today and for the foreseeable future. And while we've heard that filing for a retirement benefit is relatively quick and simple and can probably be done online, filing for DI and SSI is not. Could one of you walk us through what a typical application looks like in terms of the amount of time it takes for an applicant, how frequently they're interacting with state or federal employees? I'll leave it there.
Yeah, Joel, I'm happy to kick off, and I feel like Tracy and I are always a good tag team, so I'm sure we'll be tag teaming a lot of this. Just first off, want to say thank you to the Urban Institute for putting this conversation together. Want to say thank you especially to Chantel and to Jack for their paper and for their leadership on this issue. And I feel like you're having a fire drill, Joel, in your building today, but we kind of have a 5-alarm fire going on with Social Security's administrative funding, and I would be remiss if I didn't get in a fire drill joke since we're in that moment. So I think the place to start is to say that it's relatively simple, as you said, to access Social Security retirement benefits. But by contrast, it's actually really difficult and complex to access SSI, Supplemental Security Income, or Social Security Disability Insurance, SSDI. It's sometimes said you need a law degree to get disability benefits. I sometimes say one of my future tattoos will be that eligibility doesn't equal access. And a big part of why this is the extremely restrictive disability standard that we use here in the US. According to the OECD, the US uses the least generous and most restrictive disability standard among peer countries. It's a lot more restrictive than the ADA definition of disability. And so it's actually really complex and expensive for SSA to administer a really restrictive disability standard that just a fraction of people with disabilities who have disabilities under the ADA actually meet. But a lot of why eligibility doesn't equal access when it comes to SSI and SSDI is also, as we've been hearing, the long history of disinvestment in SSA's administrative budget. And as you said, it can be really easy to get lost in numbers and dollars and cents and percentage points when we talk about something like an agency's administrative budget. But there are really horrific human consequences of underfunding a critical agency like SSA. And one really egregious example is the current backlogs that we're seeing at SSA, which we've heard just a little bit about when it comes to disability determinations. And so Tracy may walk through some of the steps and kind of make this a little bit more granular. But as we heard from Chantel, people can wait months and in some cases, literally years for disability benefits because of these backlogs. There was actually a study by the Government Accountability Office, the GAO, just a few years ago, finding that about 110,000 people with disabilities died waiting for benefits between fiscal year 2008 and 2019. And huge numbers of people filed for bankruptcy during the same period. And a more recent estimate looking at fiscal year 23 found that number had climbed to 30,000 people dying just in that fiscal year alone, waiting for disability benefits. And the thing is, it doesn't have to be this way. And that's why I'm so glad that we're having this conversation today, because Social Security, it isn't just a government program. It's a promise that we make to each other, and delivering on that promise and on the promise of Social Security's programs across the board requires ensuring that the agency has the resources it needs to administer its programs. I'm just incredibly grateful for Commissioner O'Malley's leadership. We were hearing from him just a little bit before about some of the steps that the agency has been taking, really, truly heroic efforts to do more with less in all the ways that they can. But as I know this conversation is going to get into more, Congress needs to do its part to ensure that SSA can keep the promises of Social Security, and in particular, its disability programs, by funding the agency at the levels that it needs to bring these egregious backlogs down and to get the benefits that people need to them when they actually need them, without making them file for bankruptcy or, even worse, waiting. So Tracy, I don't know if you want to jump in and kind of get granular about some of the steps and what makes it so complicated to qualify for these benefits.
Yeah, I think you guys have done a really great job. I think between you, Rebecca, and Chantel, you've really talked about just the layers of complexity that exist for people who are applying for benefits. And we're talking about people who are either older adults or people who have disabilities. And so already they're starting from a position where, it's not going to be this simple process for them. there are really high denial rates for people who are applying for disabilities. And so you'll see only a third of applications actually being approved. People have to go through multiple levels of appeals. So if you don't have your initial claim approved, that means you have to go on to the next step of reconsideration. You have to go on to the next step that's an ALJ hearing. You have to go on to the next step that's going to court. So there are so many layers there that you often see there are people who just give up, and there are people who start the application process and are eligible but just can't keep up with the level of kind of attention and specificity and complexity that is needed to get through the process. For older adults, there are estimates now that about only half of eligible older adults actually get SSI, which means there are maybe 2 million or so older adults eligible for SSI, which is a program for very low income older adults and people with disabilities. 2 million people who are not getting these benefits, but who are eligible. And that's just unjust, because we don't need to create a program that keeps people out through all of the barriers that they impose, as opposed to helping reach the people who actually need the support and services. And I think that, to everyone's point, talking about the funding problem, SSA has a really big mandate. It's not just, we're just here to look at a file and say yes or no. It's about the outreach to the people and the communities that actually need the services and the supports that they provide. If there are communities, to the commissioner's point, that are not actually receiving benefits, and there's a way for us to do outreach to really help people understand how to get those benefits, make it easier for them to apply, that's something that SSA should be working on too. But they don't have that funding level to be able to perform in that capacity and really robustly help people who need this service in order to get the benefits that we all think are worthwhile and that we've decided as a society are important for people to have. It's impossible for them to do it. So I think that, because of all these layers and because of all the complexity that we see, it is really an unjust situation that we've created, where people can't get through all the hoops that are necessary to be able to get their benefits.
And Tracy, I want to drill down on the wait itself, because aside from obviously sitting in limbo, there is a real financial burden that applicants have. You have to maintain a level of income that is very low. It's lower. It's called substantial gainful activity. And if you're applying for SSI, not just your income is examined, your assets are examined. But what does this do to an applicant, and how do they make ends meet for months and months on end?
Yeah, it's a really strange double standard that we have for low-income people and people with disabilities who are applying for benefits. If you're applying for SSI, you're not allowed to have resources over $2,000. That is not an amount that people can really live on. And so you're saying for an individual, $2,000 is all you can have, not including your home and a few other excluded categories. For a couple, it's $3,000, as if that is this much larger number, still quite low. But as you're saying, in the meantime, people are trying to survive. They're trying to reach out to family and friends for help. They may be continuing to work to the detriment of their own, health and well-being. They're trying to scrounge. People are losing their homes, becoming homeless, and trying to still kind of apply for these benefits. And you see, this is this harm that we create. And then if by some chance they do receive benefits, we kind of continue to drill down into their lives, into this really, in a really, I would say, cruel way, looking at, who is helping you? How much money are you getting? Well, that means that your benefit is going to go down. Oh, your income or your assets are $2,001. That means you can't get your SSI benefit for that month. So we're creating these systems where we're forcing people to live in poverty and stay in poverty at the same time that we're not actually making it easy for them to get the benefits that they need to have kind of this base level of support to be able to survive. So we're creating very, I would say, odd standards for people that are already struggling and suffering. And I think that that's something that we need to be considering too. I think we're going to talk a little bit more about how we can make those rules better, because we're already creating a system where it's hard for people to apply for benefits and then making it hard for them to keep and maintain their benefits at the same time.
Right.
Yeah,
And
Joel, if I can
oh,
jump
go
in
ahead.
there.
Yeah.
Oh, no. So I was just going to say, I mean, everything Tracy said is right on. And it all comes full circle and relates back to the administrative budget conversation, right? Because it isn't just cruel and it isn't just honestly inhumane to prohibit people from having more than $2,000 in savings, right? At a level that I should note hasn't been updated for inflation in literally more than 40 years, was not even Congress's intent, right? It isn't just cruel and inhumane to prohibit people from having even an emergency level of savings. It's also really expensive for the Social Security Administration to administer those kinds of outdated and complex rules. And so Chantel mentioned a little bit of this, but I feel like it kind of can't be overstated. Just looking even at SSI, SSI is about 5% of SSA's total budget outlays every year, but it's more than 35% of the agency's administrative budget because of all of these red tape hoops, right? That we don't just make people jump through to qualify, but that we actually require them to live within, right, to maintain eligibility for sub-poverty benefits. I feel like whenever I talk about this, I think about that old movie with Catherine Zeta-Jones and Sean Connery, where Catherine Zeta-Jones was having to like go beneath all these different lasers to like break into something, right? Like that's kind of what it's like to live on SSI because of asset limits and income limits and marriage penalties and rules on whether people can give you groceries and all this kind of stuff, right? That most of which just hasn't really ever kept pace with the times.
Yeah, you anticipated my question exactly, Rebecca. And I just, the commissioner talked earlier about making processes more efficient. We've talked a lot about the increasing demand, but on the SSA end, there are things they can do, and they have made some changes through regulation, but there are also things that they cannot do. And so can you just briefly get us, through the idea of what else the agency could do versus what Congress would need to do to modernize this program?
Yeah, I appreciate that so much, Joel. And I really appreciate this whole conversation today, focusing not just on the problem, but also really, as Jack and Chantel's paper does, also focusing on the solution, because it really can't be said enough that that allowing the current state of affairs to continue is a choice. Right. It's a policy choice. And policymakers, I see we have many folks listening who are actually in positions of significant authority when it comes to making a different choice. This isn't something where we can afford inaction anymore. So we obviously need to fund the agency appropriately. That is one of the big takeaways we really need from today's conversation. I appreciated Jack and Chantel's paper for describing not just the need for increased funding, but really thinking about mandatory funding, right, as a model that could ensure that SSA doesn't have, two hands tied behind its back as it's trying to administer these programs. But part of what we really also need to see is we need to see policymakers looking at ways to simplify and streamline, and in lots of cases, update outdated rules that, as I mentioned, are just really expensive to administer in addition to doing real harm in people's lives. So SSA deserves a lot of credit under Commissioner O'Malley's leadership for doing things. He spoke about many of these that really start to improve access to these programs and also improve quality of life for beneficiaries, things like those overpayment clawback reforms that he mentioned. I don't think he spoke at length about, but it's worth just uplifting some of the really important reforms that were made by regulation earlier this year to what's called in-kind support and maintenance, right? Outdated rules within SSI that literally penalize people for having a bag of groceries given to them by a loved one or a couch to sleep on, right? So really important reforms made to those rules. More action is still needed from Congress, but really important first steps taken by the agency. I also want to give Commissioner O'Malley a nod for some of the exploration of technology for bringing down backlogs. The National Academy Academy of Social Insurance is really glad to be working actually with the Urban Institute on a task force on AI, emerging technology, and disability benefits. And Tracy, so I guess we're batting 1,000, happens to be one of our co-chairs of that task force, and Jack and Chantel are our two principal investigators. There are huge opportunities when it comes to streamlining access to these benefits using technology. There are also real risks. So we're glad to be working with the agency to really think about how to manage those risks and also seize those opportunities to bring down backlogs with the use of tech. But we also really need Congress to do its part as well. And this is where some of those kind of really honestly low-hanging fruit opportunities, many of which have really serious bipartisan support, deserve a mention too. And so, we're marking SSI's 50th anniversary this year, 50 years of SSI benefits going out. But at the same time, some of its rules haven't been re-examined or updated literally almost in as long as the program has been around. And so I mentioned those asset limits. There is bipartisan legislation currently pending in Congress that has a level of strange bedfellows we don't usually see from legislation on the Hill that would update SSI's $2,000 asset limit to $10,000 for an individual, $20,000 for a couple. A lot of gratitude for Senators Cassidy and Brown and Lankford and others for coming together across party lines and looking to make that change, something that SSA can't do itself, but which we do need congressional action on. But there are other things that we need congressional action on as well. Things like updating SSI's income rules, which haven't been updated for inflation since 1972 when the program was established, and which contribute to serious work disincentives in addition to red tape for beneficiaries, and marriage penalties as well need to be addressed. So a lot that Congress could and should do. And the last thing I'll mention, just because the commissioner did speak about overpayments and some of the clawbacks reforms that he has made a real priority, Congress has a real opportunity to look at a statute of limitations on overpayments to prevent people who are receiving benefits from fearing, checking their mail, which is honestly what we hear from beneficiaries when they attempt to return to work or to live within those restrictive rules. So those are just a few of the things, Joel. We could spend an entire panel conversation talking about more, but that's probably the tick list that I'll give you for now.
I think we have them. Yeah, I'm going to want to turn to you, Jack, because and stick on this theme because I'm opening up for questions. One of the questions was talking about, again, streamlining processes on the SSA side, because a lot of things that they're required to do, add work to their jobs. Continuing disability reviews, which are, you're looking at people on the rolls now and whether they're still eligible, even the overpayments work. And so, could you walk us through a bit, Jack, about the mandatory, efforts that the agency has to do, and also the discretionary caps, and kind of, explain the difference?
Yeah, so we've talked about the limitations of the discretionary appropriations process and how kind of stressed it is, and with the limitations on overall spending within the caps. And the vast majority of options require Congress to act to be able to make mandatory funds available. There is a conceptual option that is perhaps a little arcane, and it does require kind of going over some recent history to have it be clear, but it is certainly an opportunity available to the Biden administration. And so in 1990, at the Andrew Air Force Base, a budget deal was reached that established sort of the framework for today's budget rules around discretionary and mandatory appropriations. So back in 1991, to implement that deal, OMB Director Darman decided to include SSA's administrative budget within the discretionary caps. But that was a decision by the director because the law itself was unclear. And the decision at the time was controversial, with many members of Congress objecting to it. CBO testified at that time that they disagreed with the legal and technical justification for the OMB decision, But CBO said that the decision was in the jurisdiction of OMB, not of CBO. And so they deferred to it. And given this history, what it makes available is that the current OMB director could today reverse that longstanding understanding. And that action would remove the OSDI portion of SSA's administrative costs, about half of SSA's administrative budget, from the caps. And that's a conceptual change in what is being charged against the discretionary caps versus what's being funded through mandatory appropriations. And that is sort of the menu of options I described earlier. That is one more that policymakers should consider.
We've got a few questions in here, and these are going to kind of be scattershot because this program impacts so many different people. Judith Brown from Project 70 Forward, Dion Cannon from Congresswoman Gwen Moore's office. They're both asking about, ways to help people in the meantime, so they don't lose their housing or healthcare or food security while they're awaiting a decision. What do you recommend? I guess I'll turn to Tracy. Is that something that you've dealt with on that level, and what would you tell somebody in that case?
I mean, I think that this is where the challenge lies in terms of people relying on support from other sources, including their family and friends, or continuing to engage in work. We've seen, older adults who are still working at, older ages because they don't feel like they can make ends meet otherwise. I think it's kind of a problem in our society that they are subject to sort of these really long wait times that force them into positions that are almost untenable. We don't know what to do to help people actually maintain kind of the level of support that they need. And I think one of the pieces here that is also important to identify is the people who are being hurt are people who historically, in terms of a disparate impact, people who historically have been underserved or marginalized. And so we're talking about, people of color, women, people with disabilities, LGBTQ plus communities, people who are more likely to be living in poverty than other groups, and who have historically had to figure out ways to make ends meet in a society that isn't treating them equitably and justly. And Social Security is one of the programs that attempts to really try to address that disparate treatment and then that inequity. And so I think that we have an obligation to make sure that people can access these benefits in a timely manner, because people are living with less wealth. They're living with less income. We see in terms of women who have been caregivers for their entire life, especially women of color who have given up in terms of their own financial security, income over the course of their lives, who have been helping others and taking time out of their own, work lives to be able to support their communities and their families. And then when they get to a point where they need assistance or they need help because of disability or as they're aging, they're set up with these roadblocks and these barriers that make it difficult for them to receive help. So, what kind of payback is that for all of the work that they've put into helping other people survive in, various ways, whether it's their spouse, their children, other people in their families, their communities. These are not just situations, and I think it is very difficult for people to survive. They've been doing it for a while and figuring out ways to make ends meet, but that's not the way that we should be expecting people to get by as they're getting older and as they depend on these programs and services.
Yeah, Rebecca noted the in-kind support before. I mean, crashing on someone's couch, I guess, is now not, I would say illegal, but it doesn't count against you. But it was crazy that it did. I have a few questions here about agency leadership, and I'm going to reframe them a bit because I don't know that anyone wants to speculate about future leadership. But I think Mike Astrew might have been the last full 6-year commissioner of the agency, and certainly there have been a number of interim leaders. And I don't know if Jack Chantel, you want to talk a bit about how that hamstrings an agency long term when you're constantly in flux with the higher ups in SSA.
Yeah, maybe I could kick it off and turn it over to Chantal, but I think it's important to understand that when Social Security was made independent from HHS, and this is back in like 1994, Congress established a fixed 6-year term for the commissioner. And initially it was understood to be basically that the commissioner served until there was like a legal cause. I mean, so essentially he served a term that the president couldn't change. We'll get to that in a minute, but what that meant is that starting in the year 2000, President Bush appointed Commissioner Barnhart to a 6-year term that went through the middle of Bush's second term in office, and then he appointed Astrew to a 6-year term. So Commissioner Astrew's last 4 years were the first 4 years of the Obama administration, and so forth. And then we had gaps in there because the Senate didn't confirm people. But what we've had is a rolling cycle of commissioners that have usually not coincided with the party of the president in the White House, and that has made leadership of the agency very, very difficult. Now, recently, the Supreme Court's reinterpreted some of those statutes, but that's added a certain amount of flexibility, but it hasn't removed this basic 6-year term limitation, which is just very odd given that the president's term is 4. But I don't know, Chantal, do you want to add anything more? So.
Yeah, I think, what Jack is describing is that over the history of the agency, recent history, when, we have so much also turnover for, not fully confirmed leaders in the agency, this does impose difficulties on SSA because taking on really a really complex disability determination process and trying to make changes, especially fundamental changes that have to be implemented across the entire country by, staff in every state, systems that cross every state, serve so many people. It takes a lot of time to do that. And, by the time that a commissioner gets in, identifies the issues that need to be addressed, figures out a plan to do that, and gets all the machinery of the agency in place to start putting something together and to actually, get it going. By the time they've done that, they've run out of time often. And an acting commissioner has it has sort of, less ability also and more uncertainty about their time frame to take on those kinds of changes as well. And so in a prior paper, Jack and I looked at that, and it really stymied past efforts to improve the disability process, to make it more efficient, make it less cumbersome, still get the right answer sooner. That's what I think everybody is driving towards here. And Joel, I don't know if we're going to get to this, but some questions about, is funding the only answer or making more process reforms? And definitely the answer is both. But I think this question that was posed is one of the things that's been holding the agency back from improving some of the things we're talking about.
Yeah, I mean, please continue if you want to speak a bit about making other processes more efficient, because you're right, it's not just more money. You have to be targeted, and obviously consistent leadership is helpful in that way as well. But are there other places that you found to make the processes more efficient?
So let me just describe a little bit what Commissioner Barnard was trying to do, and at the end of her term during the Bush administration. I mean, I think she was testing out some things that were designed to make allowances earlier in the process and inform claimants who were denied, to inform them in a more thorough manner so they understood the nature of their denial and they could act accordingly. And that effort was under evaluation. And unfortunately, with the change in leadership at SSA, it was terminated before we had the final results. And so that's a kind of like an illustration of how it's possible to devise a system where you're making better allowances earlier in the process and you're getting people benefits, and you're avoiding this process of churning and forcing people to appeal. And past commissioners have tried to make improvements in those areas, but oftentimes the fixed length of their of their term has made it really difficult for them to be able to execute after they've done their research.
Right. But, and so I think, just building on that, when we looked at the factors sort of getting SSA to where we are right now, right? Sort of looking at the trends, I think one of the main takeaways to me from what we found was that in the short term, this is a volume problem. There is right now, because of the high rate of turnover and the impact on the agency's ability to process cases, the low funding, and the change in the number of claims over time that are coming into the agency, we have just an immediate short-term problem that is not going to be overcome, despite even, right, the current commissioner has instituted, just undertaken a whole bunch of regulatory changes that, and just, executive action to sort of drive productivity and has achieved a lot. But it's just with programs of this size and the numbers, this magnitude in the short term, this isn't going to go away. The actuaries, are showing projections that even if you add a 15% increase in productivity, you can't get yourself out of the current issue. But that doesn't mean that longer term changes aren't needed, that investments in IT are not critical. They are. Process reform is critical, but those take time to implement. And so I think it's why it's important to understand that the approach to funding SSA that policymakers have had, where they've sort of said, well, we'll just give them a little bit and they seem to do fine. We really wanted to sort of help people understand why that worked the way it did up until now and why it's not working now. But it's not to say that we don't need some of these deeper, even more fundamental changes that Rebecca was talking about, and Tracy are getting at about program rules and helping beneficiaries access the programs that they are eligible for and that funding is out there for. Other programs, you can't, the funding is such that, if they don't have enough of a grant, you don't get the benefit. That is not how Social Security works. The funding is there for retirement and for disability, but if you can't get through the door because of the administrative expenses crunch, that has an impact on how the program's working. And, that's the irony here is actually, in getting back to Jack was describing some of the budget options. Taking, a portion of the budget to the mandatory side, or taking some of the SSA budget, out of the spending caps on discretionary spending. That's because, the underlying statute for Social Security provides funding not only for benefits, but for administrative expenses. It's all provided. In fact, in lapse of appropriations and a shutdown, the agency has access to those funds because they've been provided to do administrative expenses. So they can keep operating because they have a responsibility to continue paying the benefits because they're based on a legal entitlement to individuals. If you meet the criteria and you apply, you are entitled to that benefit. And the agency has a responsibility to decide your claim and take action on it. Yes or no payment, in what amount, do it correctly, do it accurately, prevent fraud, do it timely, all those things. That's the agency's responsibility. So they actually have all of the funding and authority to do that. The appropriations process is layered on top of that. And it's, if some of the budget folks who are joining us today out there, I know there's a ton of folks, we call SSA's budget sometimes a limitation on administrative expenses. That's because what the appropriators do is they actually go in and rope off part of the funding that is already available to SSA and say, okay, here's what you can spend on administrative expenses. That's what the appropriators are doing because it gives them oversight. They have a role in making sure the funds are spent appropriately and in line with the will of the people. But that mandatory, this underlying mandatory authority, and whether or not SSA's budget should be subject to that process, or that all of it should be, that's why that's a question, that's an option that we raise in the paper and that has been debated in the past, and I think is coming up again today.
Yeah. I just want to leave a last word because we're wrapping up. Rebecca and Tracy, did you have anything to add that we hadn't hit on today?
I think I would just reiterate that there are people behind all of this who we have committed as a society to help and support. And I think that in all of the ways that we've been talking, we've created barriers to helping them in the same way that there are barriers to them accessing the programs. And I think we have a duty to kind of fulfill what we think is important about our community and about our society, about our country. Our country is a country that has decided that we don't want to let people live in poverty who are older adults, people with disabilities, people who are struggling. We made that commitment. And I think that that's something that can kind of underscore all of the work that we're doing here. It's to serve our goals. It's something that we decided was important. And so I think that remembering that there are people that we care about and that we want to serve is a really, I think, great motivation to making these changes and to having Congress, SSA, all of us working together to figure out how to make these programs work better and how to make sure that people who need help are actually able to get it. So I would just say that.
Tracy, I love all of that, and I'll close on a similar theme. What I often like to think about in the context of these types of conversations is what it looks like when we put ourselves in the shoes of the people who are trying to access the benefits that we're talking about here. And so underscoring everything that you just said, Tracy, right? As we think about what kind of a system would we want to be there for us when we experience a disability that means that we can't continue to support ourselves through work, would it be a system where we wait 218 days just to get an initial decision, which is usually a denial that we then have to appeal from and potentially wait not just months, but maybe even years after that before we see any level of income to help us stay in our home, our apartment, to be able to afford food and to access medical care? Would it be a system where we're not allowed to have $2,000 in the bank, or where we're not allowed to marry the person that we love, or where we're not allowed to have even $86 per month in other income before we start to see our benefits reduced? I don't think that's what any of us would set up for ourselves, for people that we love, for people that we have in our lives that we care about. And yet that is what we are allowing to exist through inaction. On the funding side and also on the policy side. So that's the note I want to just close on for my part, Joel, as we think about how it doesn't have to be this way, and it shouldn't.
Yeah, thank you both for bringing that perspective. And I know there's a lot of great questions, a lot we didn't get to. I should probably mention, we didn't even really talk about field offices, but for those that can't do these, can't take advantage of the phone or internet services, that is a challenge getting into a field office. And if you're in a rural area, it's an even bigger challenge. So, this is a pretty widespread issue and one certainly that impacts just about everyone. You're going to need to interface with SSA at some point, maybe many times in your life. And so this will impact just about everybody. And with that, I'm going to turn it back over to Chantel and thank the panelists for their great contributions today.
You're on mute, Chantel.
Almost went without a hitch there. I wanted to say on behalf of Urban, well, thank you, Joel, for moderating and for leading this discussion. And we want to say thank you to the folks in the audience for joining. A big thank you to the Commissioner of SSA and Sarah Wartell for kicking us off with that fireside chat. It was great. And thank you to our panelists, Rebecca and Tracy. Wonderful thoughts, really great contributions to this discussion. I want to say thank you to our ASL interpreters and CART captioners, and thank you to AARP for funding this research and the event. I want to let everybody who's joined us today just know it's a reminder that we've recorded this. It'll be available. You'll receive an email with a link and a survey about the event today. And also just want a closing thought leave you with is that this discussion is continuing. This issue is ongoing. Want to encourage everybody to keep an eye out for another paper that we'll be publishing hopefully at the end of this week. Jack and I are co-authoring with Rekha Balu and Karishma Furtado at Urban Institute. It's part of Urban Institute's equity scoring initiative. And this paper is going to look at how funding administrative expenses affects equity and benefits, and specifically looks at Social Security as a case study in this. So would really love for everybody to check out that paper as this debate continues. So thank you again to everybody, and I hope I didn't miss anybody. And also thanks to Jim for joining us today and helping out as well. All right, thanks everybody.